Happy Friday, welcome. This is our community of practice for this month, and thank you for coming. If you received our reminder email, you'll know that today we have Kaylee Rickardson from our AOT team and Bradley Cucuro from DWIN here to talk about the Clubhouse model. We're so excited to highlight this Clubhouse and DWIN and Brad and Kaylee, so thank you very much for participating. Just our usual reminder before we get started, any opinions and views shared today by presenters or audience members are those of the individual professionals and do not necessarily reflect those of the Center for Behavioral Health and Justice or Wayne State University. And as always, I'd like to plug our Q&A sessions. They happen twice a month. Dr. Scott Smith is available to answer. You can just pop in anytime, ask whatever question you want. It's a great resource to share with families and loved ones. So if you have some natural support or some individuals who need some answers, please feel free to send them Scott's way. As AOT gets more attention across the state, more questions come up, especially with pending legislation. So the next dates are Monday, July 13th from 11 to 12 and Wednesday, July 15th from 2 to 3. If you have any questions that don't get addressed today, be sure to attend one of those Q&A sessions. They're open to anyone and everyone. And I know a lot of you are here today because you received a Zoom link to join. So if you'd like to sign up to attend this event monthly, sign up for our quarterly newsletter, or see however else you want to get involved, please click on the link that we're going to share in the chat. That gives you like calendar invites to the Q&A sessions, the COPs, things like that. I know it's hard to keep track of everything. So without further ado, I'm going to go ahead and pass it to Kaylee and Bradley to discuss the Clubhouse model and how it may be utilized as a community-based resource for individuals on AOT.
Thank you so much, Julia, for the introduction. Hello, everyone. Thanks for being here. So just a little background. My name is Kaylee. I'm a project coordinator on the AOT team. And I also, my other world is I'm a PhD student in a counseling psychology program at Wayne State and do Clubhouse research. So it's really fun to sort of have worlds collide here. So we'll be presenting on the Clubhouse model, exploring community-based recovery for individuals on AOT. And then I have Bradley Cucuro here with me, so graciously from DWIN to present sort of some of his perspectives. And he will start us off. So we'll go ahead and get started.
I appreciate the introduction. Good morning, everybody. Again, my name is Brad Cucuro. I'm very grateful to be here today to talk about Clubhouse. Before I jump in, though, I'll give you just a little very brief synopsis about myself and my background so you guys know where I come from. So actually, Wayne State graduate. Fun fact, I had Dr. Smith as a professor once upon a time. I saw him in here, so nice to see him. So my background as far as the CMH world and clinically speaking, started my career working with Macomb County CMH for about 7 years. Pretty heavy background with outpatient treatment, working in ACT, crisis stabilization. Back in my ACT years, I actually worked exclusively with our NGRI folks and also many folks on AOTs as well. So my background is pretty significant as it pertains to working with folks on AOTs. Flash forward to my life now, working for DWIN. I have been awarded the role of clinical specialist, more specifically getting to provide oversight and advocacy for Clubhouse and supported employment. Clubhouse has become quite a passion of mine over the last few years here now with DWIN, so I'm very grateful to be here to talk about Clubhouse and also how it can very well assist folks on AOTs. So without further ado, I'll go ahead and jump into a little bit about Clubhouse. So for those of you who are not too familiar with it, it is an evidence-based program. It is specified for folks with a designation of SMI. There can be secondary designations. However, primary designation does have to be SMI. Clubhouse is completely voluntary. So unlike AOTs, you can anybody can choose to attend and utilize their Clubhouse or not. There's no term length. People will go to Clubhouse for a few years, take a break off, come back in. People will jump around Clubhouse. To specify here in Wayne County, we have our 6 clubhouses. And we have had members who will utilize one, move areas, change place because of that, and all of them with great reviews. Members choose how to utilize their clubhouse. So that's going to be participation in various activities, roles, responsibilities, and who they wish to interact with. Their big thing that they follow is the work order day. That is kind of exactly how their day is going to be planned out. They meet first thing in the morning, talk about what the game plan for the day is going to be, and everybody chooses which roles they want to partake in, whether that's working in administration, working in the kitchen, working in meeting, greeting, tours, etc. All the way to the very last person turning off the lights and locking the door at the end of the day as they walk out. So every role is accounted for. Everybody has a part in their clubhouse. Clubhouses are international, right? Right here we see a picture with Fountain House. So that was the very first clubhouse founded in 1948. However, props to Michigan now because Michigan has 40 accredited clubhouses. That is more clubhouses than any other state or country in the entire world. So Michigan has absolutely taken and ran with the clubhouse model simply because it works. Fantastic. So, clubhouse experience. Clubhouse experience. We again, to re-elaborate, the work order day, right? So this is going to explain and spell out how every person at Clubhouse is going to complete activities or responsibilities. Like I mentioned earlier, clerical administrative work. I know for our clubhouses here in Wayne County, our members are doing their own billing, right? They are doing every aspect of Clubhouse. The janitorial work, culinary work. I can attest the culinary work, phenomenal. Some of my favorite lunches so far have been at our clubhouses. I've always been very grateful to, be there surprisingly at lunchtime. Totally coincidental. Vocational skills, wellness activities, advocacy, etc. Wellness is a very big part of Clubhouse too. They strongly encourage wellness both from mental health recovery as well as physical health. Some of our clubhouses even have areas of their clubhouse for gym opportunities. So workout equipment, treadmills, yoga, etc. Anywho, so the work order day is broken down, like I said earlier, to every necessary task needed for the clubhouse. It encourages side-by-side work. So every member, every staff, they're all working together. Members are going to be engaged in every single aspect every single month. So they are determining the menus. They're going on the shopping and doing the shopping for it. They're answering the phones, giving the tours. I mentioned billing earlier. They even do the interviewing, right? The directors at our clubhouses are interviewed by members. So the person who is going to, direct the clubhouse is chosen by the members. It is absolutely a phenomenal experience. And of course, Clubhouse is going to encourage members to engage in furthering themselves. So education, work opportunities, and then social activities. I've had the opportunity to meet members who have gone and gotten GEDs, high school diplomas, bachelor's degrees, even master's degrees. And Clubhouse has been a huge aspect for those folks along the way. Of course, the Clubhouse goal, right? So there's got to be a purpose, right? Why do people, what's the point? So again, Clubhouse provides quite a vast variety of opportunities. However, what these opportunities are doing is they are improving confidence, purpose, and relationships, and also most importantly, mental health recovery, right? You're going to see this tie significantly in with that AOT here. The primary goal of employment should be considered, though, when referring a member to Clubhouse, right? So we do want to strive to, part of the mental health recovery is definitely striving for that further independence. Further independence is going to come from furthering the education and employment, right? So employment is a huge aspect of Clubhouse and it really should be considered and had that conversation between clinical teams and the member prior to a Clubhouse referral, because they're going to really heavily encourage that employment opportunity. Again, just to reiterate, voluntary. Members do voluntarily participate in the work order day. They're going to sign up for those responsibilities. They're going to communicate and socialize among peers. and they're also going to encourage others daily and engage daily. One thing that I love about going to Clubhouse is you walk in and what you see are members completely rallying around each other. It is something unlike any other experience I've ever had in my life. You walk in there, you see people so engaged, so supportive. It is an environment unlike anything else. And I've worked in such a variety of clinical roles. This is nothing like any experience I've had. The members truly do build each other up. The social skills they make here are second to none. Again, members are going to be encouraged to attend as many days as they want, but of course, we want them to come as often as possible. Again, work order day comes up several different times here. That is kind of the set out of the entire clubhouse. And then, of course, I already mentioned which days and times that they want to attend. Next on the board, who's appropriate? I already mentioned earlier, designation of SMI, right? So our severely mentally ill folks are going to be the primary designation. It needs to be. Secondary designations are going to be okay, but again, because of the, I don't want to use the term expectations, but because of the goal of Clubhouse, SMI is going to be that primary designation. We are starting to open up into the SED folks, because what we're seeing, of course, is that a large majority of our SED folks, ages 18 and older, are going to end up with that SMI designation later on, right? And with Clubhouse having that ability to see members that are 18 and older, it does make sense to approach this to that younger age. So a couple of our locations here in Wayne County, through Goodwill and through Lincoln Behavioral, both are beginning to open up their doors more to that younger population. That's going to increase enrollment and engagement in our clubhouse, which is always, of course, a goal of ours. It's going to potentially increase some of the employment opportunities, which are huge. One of the biggest roles of Clubhouse in the Clubhouse model are various forms of employment, supported employment, transitional employment, independent employment. Obviously, having that younger population in is going to open up another opportunity there. They have to meet a 25% of their average daily attendance need to be employed. Hence that comment earlier with the encouraging folks that to come to Clubhouse who do want to work. But with this younger population, we're going to hopefully open up some of those doors for more employment opportunities and increasing some of that employment engagement. So SMI designation, SED designation is okay as primary designations. Additionally, as a fun little layer here, I always like to give a little shout out to Clubhouse in general, but our Clubhouse is here in Wayne County specifically. So some of you may be well aware of, we at DWIN had completed a article, data collection, and published an article sharing how significant Clubhouse has been in order to reduce hospitalization rates here in Wayne County for our Clubhouse members. So out of a study that focused on our most recidivistic members who do attend Clubhouse, the hospitalization rate was reduced by nearly 60%. That is an absolutely amazing percentage of hospitalization reduction for our most vulnerable folks, right? So just to really drive that home and to kind of tie it in here, our AOT folks do tend to be some of that more vulnerable population, right? So the fact that the Clubhouse model is so successful, proven time and time again to be able to assist our folks who do need it the most, I just want to, again, strongly encourage Clubhouse as an option for our AOT members.
Okay. I like to go into this because, and thank you, Bradley, for kind of setting it up for us. I like to go into this because, like, I know when I first started working with Clubhouse, I was like, I'm hearing all these great things, but like, it almost sounds like, how does this work? You know, like, how do we see these outcomes? And largely, it's based on what we call social practice theory. So this is like the theoretical framework behind Clubhouse. Which is defined as a specialized form of environmental therapy that uses an intentional community to support recovery from serious mental illness. So the premise is that the community itself functions as the therapeutic agent. So who's in the environment, how they interact, what they're working towards is what drives the recovery outcomes that we see. And this pulls from different theoretical traditions in psychology and social work. So humanistic and existential psychology. So having those conditions for therapeutic change like positive regard, genuineness, and empathy, those are all built into how members and staff interact rather than it being a strictly clinical relationship. We also look at social cognitive theory, so self-efficacy and the belief that you are capable of action predicts whether you continue to initiate behavior, persist through difficulty, and cope with setbacks. And in the Clubhouse, a lot of this is like peer modeling and positive verbal persuasion. Also bringing in self-determination theory, so the idea that people have 3 psychological needs, which is to feel competent, to feel like you are related to people, and that you have autonomy. And so Clubhouse addresses all 3 of these and helps move members towards intrinsic motivation. And then milieu therapy, which this one is my favorite because it does trace back to Detroit a little bit. There was a social worker named John Beard who worked at Eloise Hospital in Detroit in the late 1950s. And he observed that the psychiatric hospital environment itself was contributing to deterioration. So he redesigned the social space to build on healthy behavior rather than only addressing symptoms. And then he went on to contribute significantly to the foundations of Fountain House, which is the first clubhouse in New York, and the Clubhouse Model at large. So within social practice, there's elements of how this actually looks in practice. So first one would be transformational social design. So the environment in a clubhouse is intentionally built to create opportunities for interaction. So the physical layout is very intentional, whether that be open spaces that encourage connection or quieter spaces that allow for withdrawal without complete isolation. You might have a snack station in a busy hallway that creates natural contact between the member running it and people passing through. The second element would be engagement, and this is what we talk about when we're drawing people into meaningful activity. So the activity itself is real and matters, and it's less about the activity, but more about the contribution that the member is making to the group and to the community. Relationship development, so relationships in Clubhouse are built through side-by-side work, and that social connection, which is often lost as maybe a consequence of the illness. That social connection provides often the primary mechanism of recovery and outcomes that we see. And then natural feedback and intervention. This one is my favorite, I think. I think it's really cool to observe. So the idea that staff in a clubhouse observe members in real time within the context of daily activities. So they're providing in the moment feedback grounded in what they're seeing. So they don't have to rely on report from something that happened earlier in the week. And it accounts for the cognitive and maybe self-reflective, sometimes difficulties that often accompany SMI. So the feedback gets to happen like in the here and now without requiring the person to reconstruct or articulate what happened later. And then the last one would be transitional environments. So this element is about bridging the clubhouse to the broader community. So the goal is to prepare members to participate successfully in settings where mental health is not the organizing focus, whether that be a job, school, or community organization. The clubhouse functions as kind of like a low risk, stable space to build skills and confidence before making those transitions, with the knowledge that support is available if they need to step back. Yeah, and then just pulling from just a few more outcomes to look at. This is pulling from a recent narrative review of the Clubhouse literature. So seeing reported higher quality of life among members, that Clubhouse engagement was a significant turning point in self-efficacy for members. They see reduced impact of internalized stigma associated with their mental illness. Like Bradley was saying, Clubhouse participation predicted improved hospitalization rates, and that higher Clubhouse attendance was significantly associated with lower overall mental health care costs based on Medicaid data.
Also, if you don't mind, just I have one thought to add to the outcomes as well, at least for in DWIN's network here. I've been recently doing, and I don't have anything published on this yet, but I've been recently doing some research on PHQ-9 scores as pertains to reduction in depressive symptoms. And we're seeing a reduction of an average of 3.5 points on your PHQ-9 score. So we're talking that's a very significant drop in depressive symptoms, showing a potential drop from moderate to mild to non-existent. So sorry,
Yeah.
just wanted to throw that in there too.
No, thank you. Thank you for adding that. It's perfect. And then just understanding recovery. I like to talk about recovery because I think within this population, sometimes we shift a little bit how we think about it. So just understanding that recovery is a nonlinear, holistic process, both a personal experience and an objective outcome. And it is not defined by complete symptom remission. Members may continue to experience symptoms while actively engaged in recovery. So I think that's the I think cool piece. I think because we all have an understanding that with SMI, you're aiming for symptom remission, but it might be more like symptom reduction, and that the symptoms don't completely go away, but they're still there. But what the Clubhouse provides is a space to be a part of community while maybe still experiencing symptoms, and kind of having like somebody to bounce off of, like, you know, hey, are you like, I'm seeing something, like, are you seeing this? Or I'm hearing something, are you hearing this? And it being like a safe space to sort of, it's like a reality, it's like a in the moment sort of reality testing reality. And it's a, you know, non-judgmental, and it's a kind of place to ground. And so I think just understanding that of like, Clubhouse shows all these amazing outcomes, but that doesn't mean symptoms completely go away. And for Clubhouse members, recovery is often defined by the individual, rooted in a sense of belonging, meaning, and contribution rather than clinical milestones alone. So that also recovery is often subjective to the person and sort of what their goals are. Brad, I saw you go off mute. Did you have
Yeah, I
something?
had a thought, but I was just going to throw in there with not identified but by complete symptom remission. And you'd mentioned just people being quite supportive of each other. If you guys get the opportunity, you really should visit some of your local community clubhouses, because you're going to see this firsthand. Yes, of course, there are people in there that are still maybe responding to stimuli, still going to have some symptoms, significant symptoms occurring, but they still are able to be such an active participant in the clubhouse. And just to validate what she said, it's 100% true, right? This community here, because it's one thing, they already have, they have case managers, they have therapists, they have psychiatrists. It's different when the member receives that information from them. It doesn't feel as genuine sometimes. It doesn't feel as understanding. For here, it's not just empathy, but people can actually empathize and understand because they've been there too. They get it. So it's definitely very much that non-judgmental experience. And people do build that understanding that they absolutely can achieve whatever it is they want to and this was in one of my earlier slides, stages of change. No matter what stage of change they're in, no matter what part of their mental health recovery process they're in, Clubhouse will and can work for them.
Yeah. Yeah, I think that's a really good addition, like bringing in the stages of change too, and it being a space for all of it. Yeah, thank you. And we talk a lot about social connection and recovery and healing through social connection. So I like to bring up to just what sort of the underlying crisis that's often associated with serious mental illness, which would be loneliness and isolation. So nearly 60% of adults with SMI report feeling lonely, compared to 3 to 35% of the general population. And that social withdrawal and loneliness have been associated with exacerbation of symptoms, maladaptive social beliefs and impaired social skills, poverty, poor physical health, and poor quality of life. So just sort of that understanding that sort of as a consequence of the illness, sometimes like loneliness and isolation occurs. And so this sort of model aims to directly combat that. And this study actually looked at, when there are individuals who may be resistant to engage in treatment, or nervous or anxious about socializing or joining a new space, like trying to understand, like, why do you show up? Like, why do you keep coming to the Clubhouse? And this study looked at that. So this was a qualitative study that interviewed about 140 members across 10 clubhouses in Michigan. And the number one reason across all reasons of why members continue to come was to reduce isolation and to have social connection. So members said things like, to get out of my apartment, it's better than isolating in my apartment alone. I get human contact. It helps me socialize with others who have similar problems. Also, something to do was endorsed as a big reason, just something to do, show up and contribute to, which people said it has enabled me to maintain my stability or keeps me on an even keel and thinking positive. And then when asked what members said would be different if there was no Clubhouse, they reported having likely more symptoms and greater loneliness and isolation. So now bringing in like AOT with it, I think like acknowledging that AOT and Clubhouse, you kind of look at them and you might think they don't go together because of differing philosophies. For example, like in AOT, the entry is under a court order, and then Clubhouse is completely voluntary. Compliance within AOT is sort of central, and within Clubhouse, it's sort of irrelevant because it's not considered a treatment. But I think this bottom piece here that's been fun to explore is just because they're differing philosophies does not mean incompatible programs. So for someone on AOT, Clubhouse may be one of the few voluntary treatment options where there's no consequence or pressure to attend. That is, that the choice to attend is entirely up to the individual, and the engagement in Clubhouse is self-determined.
Just to reiterate what was just said, right, is so many members, and I recall this from my time working with folks on AOTs, and flash forward to now, members do often feel like they don't have a choice. Of course, on a technicality, do members have choices? Absolutely, right? Our members always have choices. They can choose whatever they want to do, even if they're on an AOT. There just are consequences, right? If we do have a member engage a member on an AOT. However, with like she said, with Clubhouse, it actually offers that person an opportunity to have something that is entirely their own. Which, when somebody is on an AOT, that is so much further and fewer between, at least as far as how they feel often. So certainly a great opportunity for somebody on AOT to just really help encourage that engagement. So to elaborate a little more on our side of things here with why Clubhouse or how Clubhouse can benefit our members on AOTs, let's go through some of them. So I already mentioned earlier, stages of change, various levels of care. So we have, at least here in DWIN at our clubhouses, we have folks engaged in various levels of care. We have many members from ACT teams, from outpatient teams. We have members on AOTs that are absolutely engaged at Clubhouse. Again, like I said, the stages of change vary for those folks, but it works for everybody. This evidence-based model absolutely works as long as our person has an SMI designation. I mentioned earlier, frequently hospitalized members, right? That 60% reduction is for me no surprise, but it is absolutely statistically relevant here. So our folks who are in and out of the hospital more often than others, if they can engage in Clubhouse, we're seeing that reduction. There are so many reasons behind that. However, these numbers do not lie. So routine and structure. All of us benefit from routine and structure, right? That is a very typical, I think, human need and necessity. With folks on AOTs, having that routine, having that structure, if they are engaged at Clubhouse, we're seeing that they're more likely to engage at their clinical appointments with their case managers, with their therapists, with their psychiatrists, with their medication management, right? Because medications should be taken routinely as well. When somebody maintains hi.
Hi, I'm sorry, really quick to interject real quick. Talking about the recidivism and in and out of the hospital and people on AOTs, we have a pilot project, if you will, going called Luminor. And it's this really cool, it's supposed to address this recidivism and We have a few providers working with it, but my favorite thing about it was we can actually gather the information of our recidivistic members more easily. So I was able yesterday to download a list of our recidivistic members for the second quarter. Then I compared it to our people who are on AOTs, which, not surprising, we had about 22%. So almost a quarter of the members who are recidivistic were also on AOTs. So again, that's all going hand in hand. And if we're going to combat the recidivism part with Clubhouse, it's going to combat the AOT recidivistic part with Clubhouse as well. So just had to interject. And I was actually really excited that I figured out how to get the info out of Luminor. So there we go.
Allison, I would expect nothing less. I appreciate your interjection. To move right along. So of course, stability and independence. I already mentioned earlier, promotes engagement with case management, therapy, and psychiatry. Our Clubhouse directors all share that members engaged at Clubhouse frequently do attend those appointments more often because they're encouraged to, right? Part of the AOT is that medication management, that clinical appointment attendance, right? Maintaining their appointments. It's not an expectation, but it's encouraged, right? One of the goals of Clubhouse is to encourage that clinical engagement. So staff and other members are like, hey, you know, you really should go see your case manager about this. Have you been taking your meds today? Or have you been taking your meds this week? You know, you seem like you're having like a really rough week. So again, to complement that AOT side of things. We've already mentioned it many times, promotes positive relationships, medication management, and overall health. Improve social skills, community engagement, stronger social networks, stronger natural support systems. I will always say this, and I will stand by this. Every individual I've ever worked with over my years in the CMH world so far, you can have two members with similar diagnoses, similar symptoms. The member over here that has the strong natural supports is going to thrive and do so much better than the member without. Clubhouse helps significantly to establish that support system. Again, complementing the AOT side of things. Increases the number of days a member is seen, eyes on, right? With the treatment orders, we want our members being seen. We want clinical staff being able to account for their whereabouts. We got more of that. Of course, helps members to build an improved understanding of their need for mental health services. At Clubhouse, they do wellness events frequently. They're always checking in to make sure that people understand, you know, what's going on both with mental health and physical health. I was just at one of our clubhouses the other day, Turning Point, Higuera's clubhouse, and their wellness check-in that day was a physical one. It was a varicose veins, which for a lot of our members who are aging, where you know they see this occurring on a more frequent basis. It has been able to assist them in understanding what's going on, even though it's like we mentioned earlier. They might have heard this from their doctor, but it's received a lot differently when they hear about it from their other members at the clubhouse, their friends, who are also experiencing the same kind of situation. And then, of course, lastly, it's going to help them obtain their basic needs. One of the biggest things of folks on AOTs is not being able to have those basic needs: shelter, food, clothing, etc. Clubhouse gives them a place that they can be during the day. They're going to eat. They have, like I said earlier, fantastic lunches. Our clubhouses here in Wayne County, they have clothing closets for very low prices of like $1, or sometimes as a free donation. They will often make sure our members have clean, gently used clothes, especially if they are attending maybe a nice family dinner or a nice event, or they're going to be going for like a job interview. We want our members to feel comfortable and confident in themselves. Or weight changes, right? Sometimes people gain some weight, sometimes people lose some weight. So it has that opportunity to be able to feel good with themselves. And so again, complementing the AOT side of a lot of our folks on AOTs do tend to struggle with those basic needs, such as food and clothing. Clubhouse really helps offer a solution for that as well.
So I'll read through this a little bit, and then I'll let Brad speak to some of this as well and sort of what he sees. But as far as introducing Clubhouse to AOT individuals and when to introduce it, it might be at hospital discharge for the person returning to an unstructured environment. It may be early in the order when engagement is being established and trying to get this person reconnected to a community or social circle, or at any point of transition or instability. And then how to introduce it. You may offer a tour, come see the space, noting that Clubhouse is not a drop-off center, so it's not meant to sort of drop someone off and say good luck, but that Clubhouses are very inclusive and they want to work with anyone. And so if you call them up or walk in and say, hey, I have somebody, can you offer a tour? Or do you have a member who can speak to their experience with them and see if this is a good fit? So yeah, offering a tour, maybe a warm handoff where a staff member or peer walks them in, sort of is with them for the day, or even a peer introduction. So if you have peers who work on your team who either have lived experience with Clubhouse or just lived experience in general, to sort of speak to what it's actually like, and if that's somebody who could accompany them, maybe meet them there and be a part of that warm handoff.
Absolutely. When I was a case manager with ACT at Macomb, I had several members on AOTs, and I did exactly that, right? I called up to the Clubhouse, said, hey, I'd like to do a visit. I brought said member there, spent the day with them, got to experience Clubhouse for myself with them. And there's actually one that comes to mind in particular. He would end up having a very successful mental health recovery over several years, but Clubhouse was definitely one major layer for him in particular. Our peers, so here at DWIN, we do have some peers that do work with our AOT team specifically. Peers are incredible. I've said that for years, and I will always say that. I have adored working with all of my peers over the years, and they have always been absolutely incredible with our members. We actually have our peers here who they'll reach out to me and be like, hey, Brad, I got so-and-so who is discharged from the hospital. I'm going to bring them to their follow appointment or their intake at such and such CRISP provider. But I do want to bring up the idea of Clubhouse. What should I share with them? What should I mention? So that coordination is huge. The peer introduction is super helpful. I definitely do believe, though, like this, we said here too, hospital discharge, let's bring it up quickly. We know this person's on AOT. We know this person just got out of the hospital. Let's not to overwhelm them, but let's mention, hey, you're going into your follow-up appointment with your provider. Let's go ahead and also include maybe an interesting Clubhouse too.
Great. So just sort of to wrap things up and sort of like maybe a takeaway is what Clubhouse can do for providers, and sort of that what happens when there's a partnership or a working relationship with the Clubhouse near you, and really it helps extend your reach. So like Brad was saying, members can be seen up to 5 days a week in a non-clinical setting. They provide a consistent presence through transitions, like we've talked about. So Clubhouse does not discharge. Once a member, always a member. So it remains available through hospitalizations, housing changes, crisis. It supports engagement with your services. So like we said, showing improved engagement with case management, therapy, and psychiatry, and then just offering that additional set of eyes. And then what providers can do for Clubhouse. I think education is a part of it. So educating your team, what Clubhouse is, what it actually does, who maybe it would be good for, when it's a good fit. And then just the understanding that this is, when used with AOT individuals, this is voluntary and not part of the AOT order per se, but maybe like a complementary package on the side if it's something that they are interested in. And then just referring clearly. So again, it's works best when it's framed as an invitation, not a requirement. And then ask the Clubhouse for help. Like I said, and Brad can, I'm sure, speak to as well. And that Clubhouses are always willing and inclusive to collaborate. And so if you just have questions like, is this a good fit for this particular person? Call them or walk in, and I think they can help you figure that out and navigate. Like, And it might not be the best time. Like Clubhouse isn't right for everybody all the time. So understanding and working with them of who is appropriate, when is it appropriate, and how you can work together to support the person. And then just included this little slide showing some of the clubhouses in Michigan, and there's a link here. We'll send out the slides, but also if you go to clubhouseinternational.org, they have a directory and it'll show you all the clubhouses in Michigan in your county with addresses, phone numbers, emails, all that good stuff.
There's actually one in the UP too. Can't see it in that photo.
I know, I had to cut it out, but there is one up there.
So it's a beautiful clubhouse. Beautiful clubhouse in Marquette.
All right. And that's the end of the presentation. We can open it up for questions or comments. But thank you all for being here, for listening. And thank you, Brad, again, for contributing. We're so grateful to have your perspective as well. So thank you.
It's been wonderful. Thank you.
I have a question, and I feel like it was briefly referenced on a slide, but I just want some clarification here. So as Clubhouse is a voluntary program, if you know someone, a participant in the Clubhouse is on an AOT order, and you suspect they're starting to decompensate, are you allowed to reach out to their case manager? Like, is that sort of communication okay? That extra set of eyes, well, obviously that relationship is important for you to maintain like that trust, but is that something you're able to do, is coordinate with the AOT team and say, hey, you might want to get, try to engage with this individual?
Absolutely. No, I appreciate the question. 100% yes. So you had mentioned there, right? Obviously, that relationship's important. They want to build that trusting relationship, but of course, it is imperative that it isn't going to be in their best interest, right? Because if we're seeing them decompensate, then it is going to be on us to make sure that we talk to the clinical team. So if staff or director at a clubhouse does notice some decompensation, or if a member says to, such and such staff or director, yeah, I haven't taken my meds all week, it is going to be important that the director does go ahead and share that with the clinical team or with the AOT team, because at that point it's unsafe, right? At that point, the member is decompensating. Obviously, if they're on AOT, there's a reason or several. So it is definitely going to be for the safety of that individual to be informed. Yes, 100%. The director or staff should inform the clinical team or the AOT team. Absolutely. There was another question in the chat. Oh, yes, you already answered. Yes. Yep, everyone coexists at Clubhouse.
Are there any that are separated?
No.
Okay.
Nope. Only criteria is primary designation SMI and 18 years or older. I will say, though, we definitely want to appeal to the younger population. We're trying to, because right now, the average age on Clubhouse International, I believe it suggests the average age is about 45. I don't have this data specifically, but I would go ahead and our Wayne County directors would agree that our average age here at our clubhouses are probably over 50. So we're trying to, not that we don't want all age groups involved, not that we don't love all age groups, but we want to definitely encourage more, right? I think that our younger population can learn a lot from the older population and vice versa. I think that every age group has a lot to offer, and having this variance in ages at the clubhouse can be quite helpful to all different age groups.
Okay. Are there things that would make someone not a great fit for Clubhouse?
Absolutely. So we do recommend clinical judgment from our directors. So most of, if not all, I believe all of our directors, at least here in Wayne County for our clubhouses, all have master level clinicians. And so it is important that they do utilize clinical judgment to help determine if that person's going to be appropriate right now. Now, again, let's say, somebody is deteriorating, right? Let's say somebody hasn't been taking their medications, symptoms are coming back more heavily, they're becoming a little more dangerous to themselves or creating an unsafe situation for others. We're going to have that conversation with that member and with that clinical team and say, hey, this person, they were a member, they can always come back, always. But it seems like right now they're definitely going to need a little more intensive help on the clinical side to help get them to that point where they're appropriate again. Because this is a community program, there are a lot of other people in our clubhouses. Our clubhouses, at least here in Wayne County, for a few of our clubhouses have well over between like 120 and 150 members. So we have to look out for everyone, right? So while we do want to encourage everybody, and yes, while the only technical stipulation is that 18 and SMI, we also have to make sure that this person is not going to make this an uncomfortable or unsafe situation for everybody else. But again, that's where we trust the clinical judgment of our directors to, directors to help make that judgment call. And then capacity, they're going to change based on the actual building sizes. I know for at least several of our clubhouses here in Wayne County, they're quite large facilities. So they can usually, so right now, I would say ADA, or average daily attendance for our a few of our clubhouses are right around that 50 to 60 mark. Most of them suggest, based on current staffing and just pure size of their locations, they can comfortably have upwards of 80 plus members present during that day. For the most part, we can always fluctuate a little more. We haven't seen numbers like that since pre-COVID. So obviously something we're working towards is, getting that engagement higher again. But yeah, so I would say at least for our clubhouses here in Wayne County, they all suggested that they could very comfortably accept 30 members more daily even. So, and keep in mind, not everyone attends every day. So that's a pretty significant number. So if 30 can attend daily, we could probably see quite a significant more just member enrollment just in general.
I have a question. Is there a clubhouse participation to peer support certification pipeline? Do you know what I mean? Like, is there any kind of like workforce development in that way that happens?
Yeah, absolutely. We've had a lot of peers come out of Clubhouse. So I can at least, I'm sure there are more, but I can speak on behalf of at least two that I know personally out of two of our clubhouses here in Wayne County that I've gotten to know a couple members over the last few years, and I've watched them be able to achieve their peer certification, and now our peer supports with their corresponding previous provider agencies. Now they're able to actually be peer supports at the clubhouse and continue to expand. One individual in particular, I was just having a conversation with them the other day, is looking to even expand that peer opportunity further. They were like, Brad, I really want to come to DWIN and be a peer for you guys too. I'm like, absolutely. You have your certificate. You are 100%. You have that opportunity to apply for the job just like any other peer too. But this person started as a member at one of our clubhouses. So 100% they do. The clubhouses absolutely will assist that member in achieving that goal, just like any job, right? They 100% will help direct that member to whatever job it is that they are trying to aim for.
Very cool. Thank you.
Mm-hmm.
Anyone else have any questions? Oh, a story from Washtenaw. You've also had several members move into CPSS roles. That's wonderful. This is so great. Like, this is exactly the stuff that, is so exciting and makes a big difference. And so thank you for sharing. Okay. Any other questions? Well, I certainly learned a lot. Thank you so much, Brad. Thank you, Kaylee. We really appreciate your time and your expertise. I think this is really exciting, and it's really a great option for individuals on AOT. Thank you, Brad, for collecting data and doing that as well. That's always a big help. So thank you so much to everybody for coming. We really appreciate you spending your Friday morning with us. And don't hesitate to reach out to us if you have any suggestions for COPs, if you have any follow-up questions or anything like that. We really appreciate your participation. And our next COP is going to be Friday, July 24th at 11. And with that, have a wonderful weekend. Thank you.
Thank you all.